evaluate the radiograph of oblique foot. For the projection, the entire foot is demonstrated from the distal phalanx to the posterior calcaneus, proximal talus, and all surrounding foot soft tissue. And the first and second base of metatarsal are superimposed. This is the first base of metatarsal, and this is second base of metatarsal, and it is superimposed. And the medial and intermediate cuneiform are superimposed. For the positioning, this is the positioning criteria of the true oblique. First, the joint space surrounding the cuboid and the cuneiform is open. This is the cuboid and this is the cuneiform. And the joint space between the cuboid and the cuneiform is open. And the first and second intermetatarsal joint is closed, but the third to fifth intermetatarsal joint space are open. This is the first intermetatarsal joint space. It is demonstrated closed, and the third through fifth intermetatarsal joint space are open. And the tarsisinus and fifth metatarsal tuberosity are well seen. This is the tarsisinus and this is the fifth metatarsal tuberosity, and it is well seen. So, based on my radiograph, the positioning is correct because it includes all the criteria. And how we want to detect the rotation? If the cuneiform cuboid or the navicular cuboid and third through fifth intermetatarsal joint space are closed, means that there's rotations. And whether to find out it is under rotation or over rotation, we must evaluate the intermetatarsal joint space of fourth and fifth metatarsal. And if it was under rotation, you can see the image that I zoom here. If it was under rotation, the fourth metatarsal tubercle, the one that was round, protruding surface located distal to fourth metatarsal base, is without superimpositions of the fifth proximal metatarsal, and the joint space of fourth and intermetatarsal is closed. And you can see the cuneiform cuboid. The cuneiform cuboid joint space is closed, and the third through fifth intermetatarsal joint space is closed, and this radiograph is under rotation. The positionings of this radiograph is under rotation. So to improve this, we must increase the degree of medial foot rotation. And if it was over rotation, the fourth metatarsal tubercle superimposed with the fifth proximal metatarsal. You can see here the fourth metatarsal tubercle is superimposed with the fifth proximal metatarsal, and the intermetatarsal joint space is closed. And to improve this, we must decrease the amount of the medial foot rotation. For the alignment between the X-ray tube with the cassette cannot be determined because there is no evidence of collimation on all four borders of the films. And the alignment between the X-ray tube with the patient cannot be determined because there is no evidence of collimation on all four borders of the film. And the alignment between the patient and the cassette is incorrect because the distance between the central structure to the edge of the film on the right side and the left side is not equal, and the centering point for this radiograph cannot be determined because do not have four borders of collimation, but the standard centering point for this radiograph is at the third base of the metatarsal. For the collimation, at the superior border, structures that should be included are the distal phalanx, the medial phalanx, and the proximal phalanx. And for the inferior border, structures that should be included are the calcaneus, the tarsisinus, and the talus. And for the lateral right side, structure that should be included are the fifth metatarsal tuberosity, and the cuboid. And for the lateral left side, structure that should be included are the first metatarsal, the medial cuneiform, and the navicula. And for the exposure factor, the contrast, the bony cortical outline of the thin structure, which is the fifth metatarsal tuberosity, can be seen. And the thick structure, which is the bony cortical outline of the thick structure, which is the calcaneus, can be seen. And the KVP used is educate. For the density, the bony trabecular pattern of the thin structure, which is the fifth metatarsal tuberosity, can be seen, and the bony trabecular pattern of the thick structure, which is the calcaneus, can be seen. And the MAS used is educate, and there is no change in KVP and MAS needed. For the marker, there is no evidence of anatomical marker visualized on the radiograph, but it is in the correct position. The plumbar marker should be used and placed at the right side of the body, not superimposed with the regions of interest, and placed at the appropriate area. For the aesthetic, the film size for this radiograph cannot be determined, but the standard film size that should be used is 18 x 24 cm, which is sufficient to demonstrate all structure of the interest, and there's evidence of artifact on the radiograph, which is the white dot but not superimposed with the regions of interest. For the name, there is no patient names, ID, date of examination, place of examination visualized on the radiograph, but the patient names, date, and place of examination should be placed at the appropriate area. For example, at the upper edge of the films, and it must clearly visualize on the radiograph and not superimposed with the regions of interest. Conclusion, this radiograph is not acceptable because there's no patient names and ID, date and place of examination, and there's no plumbar marker. And that's all from me. Thank you very much for lending your ears, and if you have any question, you can ask me and I will try my best to answer it. Thank you.